Yes, welcome back to the Magic Sponge podcast, a miracle cure for all your rugby league injury issues. I'm Brien. I'm the guy behind NRL Physio content you see on socials. My co-host James is here, mate. We're here to talk about injuries. We're here to talk about, just the weekend of footy that was. But I'm just going to throw to you as I raise my bat in, I guess, conjunction with Gimpy's finest product, Tino, notching up 100 today on his return. We were huge on him on the sponge all off season. It feels bloody good to see Tino back out there and killing it, especially as a Queensland Origin fan, particularly. Hopefully he can stay fit, but how you going, mate? Good to have you. And how much did you enjoy Tino's performance today?
Yeah, sweet vindication for you, especially Brien. I know you were pumping him up in every format on every platform, so absolutely sweet vindication for you. As you mentioned on the pod, he's just an elite athlete, isn't he? He's just a specimen of a human being, and it was always going to happen. Let's just say it that way. It was never in doubt. So when he came out and turned up in Supercoach, I think we all just went, "Oh yeah, all good." Like just par for the course, play on. Guess a week's a long time in footy though, Brien. There's been a lot happening, a lot of big games, big upsets. I think if you were written off week one and you bounce back week two, that's the beauty of this comp. It's tight. There's a lot going on. I know the Finns haven't got one on the board yet, but you know, there's not much between a lot of teams on a week-to-week basis, and they haven't been far away, the Finns either. So, hopefully a win for you boys is just around the corner, Brien.
Yeah, that's right, mate. I think I definitely got on Tino enough during the week as well. The old SC Baller boys wanted to put a call out to jump into the league, their league that they've set up. So I was like, I'll just use that as an opportunity to jump on Tino even more. So I was a little bit nervous going into today, but he did very, very well, mate. I want to throw to you. You talk about like turnarounds. What happened on Saturday night, mate? The Broncos. I mean, the Finns, at least I knew what was coming. It was just a continuation of last week. But bit of New South Wales spirit about the Broncos last night. Maggie Maguire, I think, might have gotten their ear. Not good.
Yeah, I don't know. I haven't heard the old boys' perspective yet. So whatever the old boys will say will be the gospel. So don't ask me about that question, Brien. Like, I think the old boys will have plenty to say in the media this week. They'll be writing the boys off left, right, and centre. Honestly, don't know. They didn't get off the bus. Seriously, it was a bizarre one, given that they absolutely romped over the Roosters, who bounced back to beat Penrith. Like it's just bizarre competition when you look at it, because you just think, are we good? I actually don't know. Can't really answer that question, to be honest with you, mate. But tell you what, the old boys will come out firing if their thoughts are this team sucks. So stay tuned for all the stuff going to be written in the Courier Mail, Brien, up here. That'll be big, won't it?
Oh, mate, you're not wrong. And look, for those watching along on YouTube, and James, I've got your shirt lying around here, but we've got the new Magic Sponge shirt here. We've got the logo done up. I'll give a shout out to Jersey Tragic on Instagram, who did up our new logo. Loving it. And yeah, mate, I'll send one up your way, so we'll have the matching Magic Sponge shirts. They're two of two at the moment. It's not like we're looking to get a merch line sorted, but if you see two guys rolling around Magic Round later in the year in Magic Sponge shirts, it's probably going to be me and James. Maybe we'll get some hats made up too.
Yeah.
I love it, mate. All right, guys, let's get into it. As always, we are on YouTube. Everywhere you get your pods, look for us in all those places. This is where we talk about injuries, injury analysis in the NRL. We loop it all back to SuperCoach and fantasy scoring, which was big for you this week with a few guys. So hopefully we're helping you climb up those leaderboards in both SuperCoach and fantasy. We're not helping ourselves very much, so we may as well help you guys as much as possible. So let's get into the injury wrap for this week, which is brought to you by PainPod, drug-free pain relief anyone can use.
I don't know exactly what he's done. I would have thought it was an ankle, but I'm just guessing.
He shouldn't be out for a long period of time. I mean, I'm no doctor. We have to wait for the scans, obviously, but that'd be more positive than negative.
Let's rip into round two, Brien. We're going to start again, as we always do, with the HIA. So we're going to talk about Josiah, Pahulu, Jai Arrow, and Sua Faalogo there, Brien. So Jai Arrow was out of this week's game, but then Faalogo was from Queensland Cup, and I think Pahulu's been missing for the first bit of the year for the Titans, hasn't he? So it might be a bit to get through here.
Yeah, mate, I think with the interesting part about Jai Arrow, I've included him here in the HIAs. He didn't actually suffer a concussion. So I think there was a lot of confusion around this, and this is one of the reasons that I like doing what I'm doing is kind of providing that education for people. So Arrow, as my post stated at the time, he went off for 2 HIAs in a game. So both of those HIAs were considered category 2 signs, which aren't clear signs of concussion. They're not diagnostic of concussion, but it's enough for Jairo to come from the field for a test. Now, as soon as he goes off for that second test, which was still category 2, he cannot return. You cannot return after being removed from the field for 2 HIAs in a game, even if you do not have a concussion. And I think that's just around, you've obviously had 2 incidents where potentially there could have been a concussion, big blows to the head. It's about kind of taking the safe option of let's not put them back out there just in case there are some delayed symptoms. We know that can happen with concussion. So it's not something that you want to really risk. So the big question I got from a lot of people, is he going to be right for next week? Does he have to go through an 11-day stand down? No, he doesn't. Not unless he suffered a concussion, which all the indications from the Rabbitohs so far are that he passed his HIAs. So he should be fine for next week, provided he doesn't have any symptoms pop up over the next few days. So even though he cannot return to the game after that second HIA, he doesn't have to go through the 11-day stand down. So all going well, he should be right for next week. Faalogo was in Q Cup, so just worth mentioning, he had a HIA in about the 20th minute of the Falcons game. Sunny Coast Falcons, legendary team. James, your home club.
Wearing the kit tonight, Brian, too, by the way.
Mate, love it.
Love it.
Yep. Oh, mate, remember that time? I'm sorry to digress, but remember that time when they had I think you sent it to us, they had $10 jersey sale or something, and we got so much kit. It was fantastic.
One of the great days.
Oh, mate, Q Cup jersey sales, merch sales, just sign me right up for anything, really.
To me.
Yeah. So he probably will be out for next week, I would say, if he hasn't returned. And then, not that he would have necessarily played, because Paps looked like he was doing pretty well, but just in case you're relying on Sua for next week, potentially. And then Pahulu, once again, just shining a light on the fact that everybody kind of assumes that when somebody has a concussion, they'll sit out the 11 days and then be fine. From what I heard, he was having a few lingering headaches and those kind of things, but apparently he's all good now. But because of those earlier headaches, they just kind of want to, play it real safe with him. He's young, which is good. So there's been a bit of conjecture about how the Titans have treated Pahulu in the past with match payments and all those kind of things. So, it's good to see that they're taking good care of him in this respect. But yeah, just worth mentioning and always remember that with concussions, it doesn't mean if they have a concussion, it doesn't mean that they're going to be back in 2 weeks. So it doesn't mean that they're going to miss 1 week and be back the second. They can linger. They can have a longer complex recovery. So yeah, all the best to him, but it sounds like he's doing pretty well now.
That's good news, Brian, for sure. So we'll move on to the Knights versus Dolphins. Out of this one, Leo Thompson's reported as a knee injury. I think MCL is the consideration there. Then Jacob Saifiti with a cork. Obviously, I think that's probably the one to start with here, Brian, with Saifiti, because that was a fairly straightforward prospect, isn't it?
Yeah, I think so. It sounds like it was a pretty bad cork, but the Knights are still pretty confident that he'll be available next week. The long turnaround from Thursday definitely helps. Leo Thompson with the knee, it sounded like a moderate grade, because I was thinking kind of grade 3 to 4 weeks out for him. So yeah, you're probably looking at usually, and we'll talk about a few moderate MCL injuries later in the show, but I was surprised with this one because I went back and had a quick scan. I was watching this one through gaps in my fingers across my face because the fins were getting pretty pumped, but I didn't see anything obvious in the game. And then I went back and had a quick look before Thompson went off, and I didn't see anything super obvious. So, it just shows you, and I think we've spoken about this with syndesmosis injuries in the past, and now are these MCL injuries. Sometimes, guys can kind of, I don't know, somehow they must have really, really strong quads or something like that stabilize things. They play through them and then they come off, and it's a partial tear of the MCL or something like that, because oh man, all the grade 2 partial MCLs that I've seen, the instability there just is really hard to overcome. So, props to Leo Thompson for kind of getting through what he did. But yeah, 3 to 4 weeks. I think I don't know if there's many like kind of younger forwards at the Knights that this will present an opportunity for Supercoach wise, but yeah, I mean, one to look out for potentially. There's a cheapie who might come on with some more minutes. It'll probably go to like the likes of Adam Elliott and stuff like that. But yeah, just a watch, I guess. Would you think?
Yeah, I think so. I can't think of anyone off the top of my head, Brian, that'll be looking at minutes there. There's a few, sort of vet options there. I think Adam Elliott and Jack Hetherington are probably the most likely candidates, aren't they? But yeah, it might be a little bit of a watch and wait for team list and how they line up. You always got to deal with Adam O'Brien with team list, Brian. So there's always a surprise or two for the Knights if things aren't going very well. So always one to watch. Next game was Warriors versus Manly. The big names out of this one. So Tommy Turbo with the hamstring update. DCE with a back injury, Erin Clark with a hip pointer, and Luke Metcalf with a nose concern. I guess we might just start off with Luke Metcalf, Brian. This seems a fairly straightforward prospect of no major concerns, isn't it?
Yeah, I think people sort of lost their minds about a broken nose. I guess as soon as you hear a broken bone in the face, you kind of do freak out, especially now for those people who did hold him. You're thinking you're an absolute genius, but maybe he could be out. But yeah, players rarely miss time for broken noses. I reckon over my time tracking these injuries since like 2017, I could count on one hand the number of broken noses that have caused players to miss time. It's mainly because of airway concerns, like, sometimes they're that badly broken that you need to wait for that swelling and stuff to settle down so that they can actually get enough air into the lungs. But it's just very rare because you've also got your mouth to breathe through, right? So, yeah, he'll be fine, even if it is broken, which, he kind of indicated it wasn't. The coaching staff said it was. But yeah, he'll be sweet. Just worth looking. I've seen a few people talking about bringing in Erin Clark as a potential. Like, he's had a couple of solid weeks. I've got him in a few draft comps. Very happy about that. He did limp off late in the game, which looked like kind of a hip pointer mechanism. He came down really heavily on that hip. So I'm not necessarily saying he's not a buy because a hip pointer is just effectively a bruise on the hip, but he'll just be an increased risk of kind of aggravation over the next week or two if he cops another blow to that hip. I just think I cannot see how Erin Clark is in your top 3 trade-in options this week. I mean, before we go to DC and Tommy Turbo, mate, I'll throw to you, like, surely Erin Clark, I would say probably not even in the top 10 trade-in options if I'm going real extreme. What are your thoughts there?
Yeah, I agree with you, mate. I think there's lots of better options, probably at a lower price or even higher price if you wanted to go up. I think he's sort of in that mid-range in between. I don't think he moves the needle enough for you Supercoach rosters personally, so that'd be my take.
Yeah, sweet. And then DCE with his back. This is a topic you and I could probably do a whole podcast on because it's an area that we deal with day to day, sort of talking patients through this. But I find the most fascinating thing about these is that as soon as people see a back injury like this in an athlete, they go, oh, he's ruptured a disc. He's going to need surgery. He's out for months, never going to fix, and look, like, I'm not saying that to ridicule the people who say that. It's more, it shows you from our perspective as physios, like, just how the education about back pain and about these, like, I guess acute exacerbations of back pain is really needed in society, because it's really important to understand, and this isn't just for athletes as well, this is for you at home. Yes, there are back injuries that, have underlying, structural damage, and whether that be disc bulges, ruptures, herniations, all those kind of things, pinched nerves, facet joint degeneration, all these kind of things. But you can have those things and it not be the major driver behind back pain. And also you can have 9 to 10 out of 10 back pain, like Daly looked like he was dealing with. He couldn't even walk at one point, and there be no real underlying issues. And the one I throw back to a lot is Jahream in 2023, mate. He looked even worse than DCE. I think I posted it on my Twitter and on my Instagram story. But if you remember that Jahream incident, mate, he had to effectively be carried off nearly. Like, he was in all sorts of trouble, and he played the next week. So it's the nature of back pain. Backs can be the thing I say to patients all the time is the severity of pain does not always equal the severity of damage. So you can have 10 out of 10 pain and it seem really, really bad, but it's not 9 or 10 out of 10 damage. You're not getting your back, shot by a gun or something like that. Like, it can be really, really bad in the short term, but settle down really, really quickly if you just treat it well and get on with things. And that's, as I said, that's not downplay any of the severe week-on-week back pain that I'm sure many people listening are suffering, because that absolutely obviously is out there. Physio wouldn't probably be a profession if that wasn't the case. But yeah, just worth mentioning, and all the signs are good so far with DCE. Apparently pulled up really well the next day. All his scans have come back clear. So it's sounding good for him. But I'm sure in your job day to day, particularly working in chronic pain, James, you deal with this kind of topic fairly commonly.
Very frequently, Brian. Yeah, and you've hit on some of the really good points there about, probably pain severity not always being a really accurate indicator of tissue health or tissue damage, I suppose, is one of the ones we see very, very frequently. And that's really hard to reconcile with, because, obviously if your pain is severe, most people are going to assume that there's something serious going on, which is a normal thing, and that's how we've been raised, and that's how, our body generally does work. But it's not always the case with these sort of things. And yeah, you do need to sort of take a step back sometimes and have a look at, the functional impacts with this sort of stuff. For DCE, it might have been a case of he was sitting on a long haul flight and he's got to take a case of dad back. That's what it might be. It may not be anything more serious than that, Brian. It could just be a
Mate, that's how I get out of bed 3 days a week.
Back. Yeah,
like
100%. Yeah, like an old man getting out of a bath. Like, it's not pretty to look at, but it could be something that simple. But yeah, I think for DCE, you obviously, I think there was a comment he made that there might have been an impact preceding it as well. So I think there might have been some impact over
calf
the top
cork,
of it as
he
well.
said. Well, he said he got a calf cork, which threw off his running mechanics or something like that.
Oh, right,
So.
okay. That's interesting. Yeah, right. So, there might have been that preceding it, and that should be something that settles down reasonably quickly. Now he's back home in the Northern Beaches, and getting looked after there. So, yeah, no big concerns for DCO. He probably looks like he's a pretty good chance for next week. He doesn't miss many games, Daly Cherry Evans, does he? He's pretty robust on the injury front.
No, I'm definitely more confident in DCE than this next guy who we're going to talk about, which I'm sure is why a lot of people have come along to listen. If we have any new listeners this week, it's Tommy Turbo, and what's going on there. What are we going to do with Tommy Turbo? Mate, yeah, like we talk about this every offseason. We're like, look, we're in on Tommy Turbo until he gets injured, and then we're out on him. I think at this point in time, it's going to be a bit of fence sitting, I guess, for me in this podcast, because I want to go look at the positives, right? Like, obviously they've had scans. There's no new fresh damage. He just felt tight in through his lower back down into his hamstring. And there being no damage there is obviously a big win. If there was any damage, I'd be so out on him, it wouldn't be funny. So there's positive signs there. And for any Manly fans, I know there was a lot of Manly fans in my DMs and in my comments telling me that I was overreacting by even by even posting about Tommy Turbo, because it was just tightness and, no big deal. But I guess what I'm the downside to this, and what I will say, is that anytime any player, whether it's Tom Turbo or some guy who's 17th best player on their team, if they have a history of 6 to 7 hamstring injuries, well, yeah, this is the 7th now, or the 6th, depending on how you want to clarify it. But he's got a history of 6 hamstring injuries. He limps off with hamstring, and you can call it tightness, you can call it awareness. I wouldn't care if it was a tickle, James. If he had a tickle in his hamstring, it's a big deal. Because the big thing about any awareness, we'll call it, in and around the hamstring area, is it is the biggest indicator for future soft tissue strain risk. Like the examples I always use with this are the number of times we've heard about pec tears over the years, where guys will be in the gym. I think it was Nathan Peets back in the day, and I know there's been another one since too, where they're like, oh yeah, I was getting some soreness in my pec, but I just kind of didn't say anything to the medical staff, and I just kept going, and then boom, I ruptured it. Right. Like, and they're just some specific examples, but that happens across like these guys. We've got a really good mate of ours, Lockie Keefe, who plays for GWS, and he's sort of walked us through, like, they have an app and they fill out on every morning when they wake up, they've got an app and they indicate like where they're feeling sore on their bodies. They'll, tick a box or, put a thing on a, an image of a body if they've got any soreness there, because the medical staff want to know about that, because that can be a precursor to future injury risk. So the main hope, which I know sounds weird, is that, like, I hope this is coming from his lower back rather than his hammy. Like, they seem to be indicating that it was like some lower back stiffness as well as hamstring tightness. So I guess in a weird way, you kind of hope it's like a sciatic nerve irritation where he's, once again, maybe him and Daly sat in the two worst seats on the plane or something like that.
Give them exit rows next time, boys. Come on. Like, they're the two most valuable players. Put them in the exit row.
So maybe there's like some irritation of the sciatic nerve, which was causing referred pain down into his hamstring. And so in that kind of case, like, not saying that doesn't, because that can put extra pressure on his hamstring muscles, which can make him more susceptible to hamstring strain risk, but it would still be more desirable than like pure hamstring tightness or awareness. That is like the muscles letting him know that, hey, we're not really happy at the moment. So he is someone, like, I think if you, I don't have, sorry, I've got 3 bigger issues this week in my team. So I am absolutely holding him. I think Manly would be crazy to play him next week, personally. Like, even if it is just awareness, even if it's a tickle, even if it's nothing, I just can't see how you would play him next week. And that's even like, I'm not assessing him. I'm not trying to, if they do play him, it's not me talking down to their medical staff or anything like that. Just from a pure, like, any kind of awareness or issues in that area, you've got to be careful with when it comes to Tommy Turbo. But yeah, I'm holding him from a SuperCoach perspective. I'm definitely concerned about increased injury risk, which he was already at an increased injury risk. It just goes higher again. I think if you don't have 3 bigger problems, then I'm not against trading him out at all. But I guess my approach is I'm going to hold him until it becomes really clear that he's significantly injured, if that happens in the future, or it really affects his performance. And probably the thing where I'm getting a little bit of PTSD, James, is this has given me the feels for, remember, I think it was not last year, the year before, that whole like back, hip, pointer thing, which like started off like Manly was super cagey about what it was. He was getting injections to kind of try and settle it down. His performance went through the floor, and then he ended up straining a groin because of compensation and had like 4 or 5 weeks out or something like that. So yeah, like, I'm not holding on to him excitedly is the way I would put it. Yeah, how are you feeling about him at this point in time?
To your point, Brian, I've got way bigger fires to put out in my team. I've got like multi-story buildings on fire in my team at the moment after the week I've just had. So there seems to be bigger issues, but I think the other thing is it makes a really dicey week-to-week captaincy option. I think before the season, we we're like, holy hell, look at the draw. Look at those first 7 weeks. I want to captain him like 5 times. I don't think you can do the captain on Tom Trbojevic anymore. I think you just got to look at other options that are probably going to be a bit more favourable. Every option's a risk, I suppose, but this one just doesn't feel good to me. On the point of Manly being cagey about it, I think it's unlikely to line up. I think scans were negative today, so that is one good thing. If there was nothing on his scan, then that is a good thing to hear, that there's no structural concerns or pathanatomical concerns. That's very good. But yeah, do they wrap him up in cotton wool this week? I don't know. It's if I didn't have as many issues, I probably would look at moving him on, because he's in my flex, so you can move him to basically anyone. And I guess, if I didn't have as many options, I probably would trade him, but I think I've just got to hold him tight and hope that he's a number for me this week coming up, I suppose. So yeah, it doesn't feel really good, but I don't know. There's very few options you can sort of go around it, I suppose, because I guess the only good thing is Manly do play on the Sunday. So it does give him, what's that, 9-day turnaround, I suppose, from the Friday night game in Auckland. So he's the very last game on Sunday, but that does create, a chance of him playing is better. But then you also have to find a reserve that you can flick to at the last minute for the last game of Sunday. So it's a bit of a sticky one for super coaches out there, I suppose. The good thing is they have the Raiders on the Sunday, so you probably own a fair few Raiders because a lot of them are fantasy relevant. So you might have to flick it on to someone from the Raiders there. I don't
Tamale
know.
is probably gonna
Tamale
be my
might be a
option.
start.
Yeah.
Mine might have to be KO Weeks, which makes me vomit in my mouth, but that might be my reality this week, Brian, by the look of that, because that could, it's going to be bad anyway, but that might just seal my fate.
Yeah, I just think exactly to your point. That's like, if people are here wondering what they should do, I would just like if Tamale is named, I'm just I'm going to be bringing Tamale in, and he will be my Tom Trbojevic. Insurance in that. Look, it's not ideal, and I think, as I said, like if you don't have three bigger problems, you should trade him out. Is the way, but I think the hard thing, as you said, like a lot of the options that you're looking to trade him to at the moment, like you probably trade him to Gutho, but then like even Gutho's got to buy the next week. So like Reece Walsh didn't do much over the weekend. Keeney looked okay. The Titans, who knows there. So it's not like there's a standout option there. To go to potentially. So it definitely gives you some possibilities and maybe some team variation, which we love in Classic. But yeah, I just think you can't captain him next week, even if he's named to play and they're like, yeah, he's definitely playing. I just think with the injury risk, I don't think I could captain him. And then you have to have some insurance sitting on your bench if you are going to ride it out, which I plan to do at this point in time.
Yeah, nice summary there, mate. Panthers Roosters is the next game, so I guess we'll discuss very quickly Dylan Edwards with his groin concern. That's one that's going to have fantasy implications. But then Isaiah Papli'i was ruled at pre-game with a hip flexor. It doesn't sound serious from IPAP's perspective. Brian, are we expecting him to miss another week?
Mate, I just want to quickly say something. I can't believe I got through like 10 minutes that I spoke about Tom Trbojevic and I didn't say the one thing that I had in my notes. Is that
Sorry.
No, this is my fault. I've got it in my notes. I think Tom Trbojevic, you could say, James, that he's a bit of a ticking time bomb at this point in time. I just wanted to get that in there,
You'll get clipped up into news.com now. That's going to get clipped up and you love it. So you're sick for
get
it.
Get some headlines happening this week. Idiot Physio on podcast says Tom Trbojevic, ticking time bomb. Siebes will come out and confirm it. I love it.
Yeah. I'm sure he will. Yeah, friend of the show, Tony Siebes, obviously. Yeah, all right. Sorry, we'll go to we'll move on to the Panthers Roosters. I think I've already mentioned those two boys, but IPAP, I've got him in draft, which was really annoying. Even though I got absolutely pumped this week in one of my games. Hopefully he's back this week, Brian. I'm hoping for all other rosterers in the draft format, especially.
Yeah, it didn't sound like anything too major. Like he was obviously named for the. Oh, was he named for this week?
Yeah,
Yes,
he was, and he was
and he was
ruled out a little bit later.
Late rule out. So you always hope that when it's a late rule out, it's just something he's failed to overcome and he should be right for next week. Hip flexors aren't particularly worrisome long-term wise. I'd be pretty hopeful he's back this week unless we hear confirmation that's like a significant tear or something like that. Dylan Edwards with the groin, I think this is the most interesting one because a lot of like your minor groin strains players can often play through, and Dylan Edwards tried to do that early on, like he suffered it, he got it strapped up and he kept going. You could just see it really affected his zip, his acceleration, his agility, those kind of things. The whole chase where he had to try and chase the guy going back, he was running in quicksand. So it's probably a moderate strain, I would assume, because you've got someone like Nicho Hynes, who is going to talk about soon, who has been playing through a groin strain. So some of those minor ones he can play through. But yeah, obviously this has gotten to the point where he can't. The main thing is on return, they still can have a little bit of agility, acceleration stuff, because as I said, you can kind of come back before it's 100%, if that makes sense. So he doesn't have to be quite 100. That return to play versus return to performance, there usually is a little bit of a gap with those moderate to high grade groin injuries. So Dylan Edwards is someone who, even when he comes back, I expect him potentially, he'll still go north-south to his usual abilities, like still, probably run for 250 meters, but more just that performance in terms of, like quickness off the mark, those kind of things might be a bit limited when he does come back.
The one to watch there, Brian's Dane Laurie, because obviously he will sub in for Dylan Edwards. And look at this for a draw. They have the Storm this week. Bunnies, Cowboys, Dolphins after that.
Oh, there's your Tommy Turbo
that's a
trade-in, isn't
play.
it?
That's a play, isn't it? Like, I think you could, you probably don't want to do him against the Storm, but if Turbo's ruled out, they do play on a Thursday though, so you're probably not going to know. Like they're the early game this week, whereas Turbo's the very late game. But Bunnies, Cowboys, Finns thereafter, that could be an enormous run there. And I think Dylan Edwards was estimated to be in that, at least a couple of weeks range.
2 to 3
Tell you
weeks
what,
out,
it'd be really nice if they pushed him out 4 weeks there, Brian, because that would be a pretty juicy little draw there.
And
so
groins can linger on, so yeah, potentially.
They can, yeah. I think especially for drafters, that's probably a huge one. If you can somehow snag him in draft and keep him stashed, that could be really, 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 really helpful. Not that too many people are light on fullbacks, I suppose you could say. Next game, Brian, was Dragons v Bunnies. So out of this game, sort of Moses Suli was ruled out during the game with a rib injury. Tallis Duncan was ruled out with a hamstring injury in the game. Then Josh Schuster was ruled out with a calf pre-game. I guess Josh Schuster's probably a bit more in-depth chat, Brian. So why don't we start with Moses Suli and get through him and Tallis Duncan to start?
Yeah, so Sully with the ribs, there's no indication that it's fractured at this point in time, which would be kind of that 3 to 4 weeks. Usually with these rib injuries, I mean, he played through it since the first half. I think it was right before half time. I saw him first holding it. So he'll just need some needles, he might need a week off at worst, but usually they needle it up. They put some, some padding or some protective gear on there. And he's just an increased risk of in-game aggravation moving forward. Tallis Duncan with the hamstring, mate. Another soft tissue injury for the Rabbits. They are just stacking up left, right, and center. The main thing I want to comment on here, two things. Number one, he did grab higher up on the hamstring. Just as a general rule for people, learning moment is that strains higher up on the hamstring tend to take longer. So if you have, let's say a grade 2, which is like a partial hamstring tear down lower on the hamstring or even middle of the hamstring, and I will say, like, tendon is obviously a little bit longer than muscle, for example. But let's say in the actual muscle itself, if you have it down lower, that grade 2, and then you have it up higher, the one down lower usually will come back a week or two earlier than the one up higher, even with the same amount of damage. Just seems to be the amount of force that's put through the hamstring up higher. It takes that little bit longer to come right. So, yeah, whatever he's dealing with there, and it definitely didn't look like, like a minor strain, for example. It seemed like he was quite affected by it. So potentially you're looking at kind of 3 to 4 weeks best case for Tallis, unless he wins the lotto and comes back with a minor strain. The other point I wanted to make on this was people were asking about the test. They thought it was like Tallis was reacting to something that the physio did to him. It looked like they thought he was putting it on stretch. But what Tallis was actually doing, he put his leg up on the physio's shoulder, and then Tallis is trying to lift his bottom off, or his butt off the ground, and that tests your hamstring. So it's like a hamstring test for strength to see if that, reproduces any pain. So he got quite significant pain when he did that. Obviously, we all saw that. So it wasn't that the physio was putting it on stretch. It was that Tallis himself, guided by the physio, obviously, but they were testing the strength of the hamstring to see, whether he could stay on and function, and he obviously couldn't. But mate, our big, Joshy Schuster, friend of the show because we've talked about him that many times on the show. Look, I don't want to get too negative about it. I think the biggest thing I've got to say here is where he suffered it in early December, this calf injury. And the report this week was he might be back, or they're expecting him back in 4 to 6 weeks. That would be a 4-month recovery from a calf injury, which Mate, like I know Schuster's had a lot of calf injuries in his career, but 4 months for a calf, I have never. Like I think like Latrell, maybe it was like 10 weeks, and that was because he had like multiple aggravations. So potentially that's what's happened here with Schuster. But yeah, I think my main messaging here, because I know as soon as Schuster comes back, people are going to be excited, especially from like a super coach perspective. He's pretty cheap. I just would not go there until you see a good 6-week sample from him. And I know his price might have theoretically gone up by then. But yeah, like just the soft tissue strain risk for him moving forward. I don't see how you could, like, if I had to nominate one guy in the comp who I expect to suffer a soft tissue strain in the next 12 months, or who's the most likely, like, he'd be close to the top of the list. I know you've had your, say on Schuster's kind of conditioning and those kind of things in the past, but from a super coach perspective, even when he comes back, you just got to avoid, don't you?
Yeah, I agree with you there, Brian. And to your point about his length of time rehabbing a calf injury, that's extortionate to do it for that duration of time. And unless they're not reporting the accuracy, maybe it's a partial Achilles, maybe it was, bilateral Achilles tendinopathy. I don't know. Like there might be a bit more to this story than just calling it a calf and putting a generic label on it. But for anyone to be rehabbing for that duration of time, that is alarm bells everywhere. So it's either an injury that's not responding, it's either multiple injuries that just the chronicity of them's just setting in. Maybe it's adherence to rehab. I don't know. Like that, not putting that on Josh Schuster as well. But when you see things linger on for this amount of time afterwards, you got to ask the question of like, well, what's doing here, Bob? From the diagnosis point of view, from the injury point of view, from the patient point of view, from the Meko's point of view. There's a lot of factors at play here, but that duration of time is crazy. Like I can't remember anything like that personally. I don't know. It just seems pretty unheard of, doesn't it?
Yeah, 100%, mate. So look, like all power to him. I hope he can get back out there. Like us talking like this, I don't want it to come across like I don't like Schuster or anything. Like I love watching him play. Like back in those Manly days when he's
Rookie year,
tearing up.
Brian.
Oh mate,
Far
like
out. The
some of the best footy ever. So nothing would make me happier than to see him get back out there and just tear it up. So like good luck to him. I hope he can get over it. But I mean, yeah, we're here to talk about injuries and yeah, we're just talking about how the fact that this particular injury situation is very unique. And so hopefully he gets on top of it.
Cowboys Sharks is the next one, Brian. So Nicho Hynes has been reported as a groin strain now after everything that's gone on. Good to see him off the kicking tee this week, especially for him in my fantasy team. I was very happy to see that. Then Braidon Burns from the Cowboys was ruled out with a hamstring injury. He's another one who's had a history of repeat soft tissue stuff. This looks sort of fairly moderate at least, I would say, Brian, doesn't it? So this might open the door for someone in the cheaper bracket to emerge at the Cowboys down the right wing. But is that super attractive with what they're putting out each week? Probably not really. The Cowboys are in a bit of strife, aren't they?
Mate, I was very high on, whoever was going to be the right winger on the Cows in the preseason. I thought Scotty Drink would be, feeding him tries all year. Semi Viliame was my big call, so maybe big old Semi comes in, but yeah, not now. You can't. You just cannot go there. So yeah, like thoughts go out to Burns. Like he's a player who has really, really battled hard with injury. He's had like patella tendon ruptures. He had multiple big hamstring injuries. He's got another hamstring injury now. You could see he had his head in his hands, in the sheds. And that to me is a guy who has had hamstring injuries before. It probably tells me that's not just like a minor tweak or something like that. Which is really, really disappointing. I hope that's not the case. Hopefully he's just, boxing at ghost kind of thing. But I would say he'd be looking at 3 to 6 weeks off the back of it, probably being that moderate. moderate grade hamstring issue. But by all accounts, he absolutely smashed preseason. Like, he's obviously won that job over the likes of Alame, Rob Derby. So Rob Derby's a guy who might come in as well. But yeah, so thoughts go to him. Nicho Hynes with the groin, mate. We just got that in here because finally we had it confirmed. Fitzy offered up the information, which would have been wonderful to know that it wasn't just groin tightness. And I think this is like to the point about Tommy Turbo, to all the Manly fans who were, having a crack at me for posting about tightness. Like, this is something where Nicho Hynes was just adductor tightness, right? And it turns out he's been dealing with a groin strain this entire time. Katoni Staggs came off in the preseason with like quad tightness. And it's, he's been out 4 to 6 weeks with so it's not me. I think someone like accused me of like trying to feed into the hysteria or get Instagram, engagements. And I'm like, I could give 2 shits about Instagram engagements when it comes to this kind of stuff like that. Fair enough if I'm, trying to do a fancy video or something like that, fine. I want to get as many engagements as possible. But this, I'm just like, I'm just posting so people know what's going on. That's all I'm doing. I don't care about that kind of stuff, particularly when it comes to these things. So, yeah, like, it would have been lovely to know this about Nicho preseason. Like, it probably would have turned me off him, to be honest, if I knew it was an actual strain rather than just some tightness that he noticed in the trial game. But we're here now. We now know that it's a groin, or it had been a groin strain. It's gotten to the point, thankfully, where it's healed enough that he's back goal kicking pretty well. A few of the kicks look pretty wobbly though, James. I must say they weren't end over end, pristine lookers, but they did get over. And I mean, Sifa Talakai got the last kicker goal. I think it was his but like a milestone game for him. So got a kick, but I really could have done with Hynes' extra 4 points there. But yeah, I think just moving forward, people have asked like how long, until he's 100%. As I said, a bit like with the Dylan Edwards thing, it usually takes a little bit of time. So you're probably looking at he might not be 100% for a couple of weeks. But, I mean, he's back kicking. He's back laying on tries. I don't necessarily think he's a buy this week. I think there's probably plenty of other better options, but I certainly would not be selling going into a Bunny side, with more injuries. I mean, they've won 2 from 2 and credit to them, but that, especially in the forwards, they are real low on stocks. They've just lost Hubner to a suspension. They've lost Tallis Duncan as well. So, yeah, I am playing Nicho with all my might this week. What are your thoughts, Nicho? Not a sell, not a buy. He's kind of just a hold for owners, hey?
No, just keep the faith. Just keep the faith with the magic sponge on him, Brian. We've slurped him all season, so don't give up on him after 1 week. So good to see him back with a goal kick. And honestly, the Sharks are going to be a good team. I think you want a piece of him because they're going to be a top 4 team. They've looked the good so far to start the season. Depth everywhere, strike everywhere. What's not to like there? Raiders Broncos, the boil over for the Raiders here. They played well, to be fair, the Raiders. Zac Hosking out of this one, broken hand. There'll be a few people that own Zac Hosking, I reckon, because he's quietly emerged as quite a handy Supercoach player, Brian.
Yeah, 100%. I touted him in the preseason. He was a big buy for me, particularly in draft. I own him in like 3 draft leagues. This is a bit of a big hit for Brian's drafts, unfortunately. But it should only be 3 to 4 weeks. Like, even if it needs surgery, it shouldn't be too crazy. So the only unfortunate thing is like the Matty Nicholson, the Pom obviously had a blinder of a game. So it just brings about the opportunity that, if he has the next 3 to 4 weeks to kind of establish himself, does Hosking come back to a limited minutes role, those kind of things. Yeah, it makes it hard. So, but yeah, I was big on Hosking in the preseason. I thought he played really well the first 2 weeks, had 2 good Supercoach scores. So yeah, just one of those unlucky things with a broken hand, but shouldn't be long. Like 3, you can get out to 6 weeks if there's some soft tissue involvement and it's a really severe one. But hopefully we're looking at around that 3 to 4 week return to play.
Good call. Eels versus Tigers next. So Jahream Bula was reported as an ankle injury here, Brian. I didn't catch video of this, so I don't know about severity. Then the other one was Starford To'a. Yeah, there was talk about him maybe being fantasy relevant because of his price point, which was attractive. Not too sure of his injury status here, Brian. So maybe just kick it off with Star To'a because Jahream Bula, if he's more serious, we might be talking about him a bit more.
Yeah, Toa, I literally haven't. I just saw he went off with about like 10 to go or something like that. Like he came off early and I don't know why. He did look like he was struggling with something a little bit. I don't think, I mean, the game was well in hand. So, but I don't see why you would sub off even a center with 10 to go in a game with it in hand. So that was a bit confusing to me. So I haven't, I spent most of my afternoon dealing with the Bulldogs Titans. So I didn't get a chance to review the footage super thoroughly. But yeah, something to watch out for with Star To'a. Jahream Bula, I did see, and once again, I haven't had a chance to sort of go through this game really closely. He went to score. He was close to scoring a try late in the game. He went down sort of heavily on his right ankle. It looked like it looked like it got squashed into the ground and his heel got pushed down and it looked like a high ankle kind of thing. But he was already out on the wing and I went back and quickly scanned through and it looked like he was struggling with something before that as well. So I haven't been able to nail down the mechanism yet. Unfortunately, he said post-match, I think it was on Triple M, that he was hopeful for next week, but he did look to be struggling pretty heavily. And they brought him off once again, game in hand. I recognize that, but they brought him off and defended the last couple of minutes with 12 men. So they obviously had the game in hand, but it was obviously bad enough that they're like, look, just come off. So I am a little bit concerned that there might be a high ankle sprain there. And as we've spoken about with high ankle sprains, they can be something where, even if he did it earlier in the game and played through, doesn't mean it's minor. It could be something that needs surgery. So I'm a bit nervous about that one, but I don't have enough information at this point in time to give too much of an indication, unfortunately.
Be watching way, Brian, especially for team lists. So the last game of the round actually was the Bulldogs v the Titans. So two big names out of this one, both with MCL injuries. So Matt Burton and Viliame Kikau, both very fantasy relevant players. But then also AKP from the Titans there, Khan Pereiera with a calf injury, and Sam Hughes from the Bulldogs was ruled out pre-game with a syndesmosis injury. This year they're a bit more deep in the forward stocks, Brian, there, but with a syndesmosis injury that's requiring surgery, probably 6 weeks for Sam Hughes, you reckon?
Yeah, 6 weeks, I think. The interesting thing here is that they initially treated it as a grade 1, like, a minor syndesmosis injury, but it came out that he required surgery and was more like a grade 3. So people asking, how does this happen? Our good friend Gus came out and said he didn't think it was more a misdiagnosis, more it was like how he responded to rehab. And I think this is an interesting point. And funnily enough, we, on Friday at Active Care, where I work, we run in-services for all the physios, or I run in-services for all the physios. And we did syndesmosis injuries on Friday. And a really interesting case study that I came across was one in the English Premier League, where they had a player who suffered for what the scan said was a grade 3 syndesmosis injury. So all ligaments completely torn. They were really quite concerned about him. But on all testing that they did, they were like, this seems fine. Like he was weight bearing really well. On palpation, he was really good. His range of movement was really good. So they were going to send him for surgery off the back of the scans, but they went, well, you're testing really, really well. Let's not. Let's just treat it as like a grade 1 to 2 and see how it goes. And he was back in like 4 weeks. No surgery. Did really, really well. So I guess what I'm saying here is it sounds like this was the opposite of that. And I just want to say that in that scans don't mean everything, right? And especially when it comes to something like a syndesmosis injury, scans can say something, but if functionally it's very, very different how that player is presenting, you might need to take a different path with your recovery. So they might have got a scan that said minor damage here and there, but they've tried to do rehab with him for the last 2 to 3 weeks and it just hasn't been responding. His range isn't coming back. We know how good players come back from this syndesmosis tightrope surgery. So they probably just got to a point where they're like, no, let's just treat it like a grade 3, going for surgery. So yeah, an interesting, or I guess a good thing for people to know is that scan results in these kind of cases, they they aren't the gospel truth. It's not the be all and end all. Alofiana Khan Pereiera with the calf, they were a bit worried about him, especially for a player who relies on speed, which calf is a big part of acceleration. So I can't see him being back next week with that being such a big part of his game. He said he'd go for scans, but yeah, like I'd say a multi-week kind of thing if he has any kind of calf tear there. The two big ones, Matty Burton and Viliame Kikau with the MCL. Look, all the jokes in the world about the relationship that Gus and I have on Twitter, but there is no one better in Clubland than him when it comes to this stuff, because he's already tweeted tonight a fantastic injury update with like more information than you could ever want on these guys. They haven't even had scans yet, and he's already tweeted out like grade 2 MCL suspected for Matt Burton, usually 4 to 5 weeks. He's having a scan at 9 o'clock tonight, so he probably had it a couple of hours ago. Billy Kicks is getting his scanned tomorrow morning, but they suspect like a grade 2 to 3 MCL injury for him. So like for Gus to tweet out stuff like that, and they're also going to check for secondary damage with Billy Kicks as well. So yeah, like that's awesome. I like all the props in the world for him doing that, because that is just so good for fans. Everybody gets a really good idea. It's not gospel truth, as we know, but it's just so good for people to know what's going on. It doesn't change any competitive advantage stuff. Obviously, if the players aren't okay with it, that's a different thing. But yeah, it's just great for fans to know what's going on and where things are at. Now, people have asked, how could they know? Like, how can they be saying grade 2 or grade 2 to 3? They don't. I think one of the group chats I'm in, the deep 20-man draft comp that I'm in, one of the boys asked, like, how do they know that? Do they have like a portable scanning machine or something like that? And it's actually more than likely the hands-on tests that they do. So the hands-on tests that they do for any ligaments, but particularly in around the knee, you kind of, the way that you push it is you're putting stress on those ligaments. So if there is a partial tear in that ligament or a full tear in that ligament, when you push the knee in that direction, it will be really loose. Like when the ligament is nice and together and uninjured, you will try and stress it, and the knee just won't go anywhere. It will just be really solid. But if there's a partial tear or a complete tear, obviously there will be more give. And we have ways, if there's a partial tear, it only, moves a certain amount. You're probably going to have quite a bit more pain because you're pushing on a ligament that's only partially torn. So that's going to stress it even more. So it's going to be quite painful. If it's a complete tear, it's going to have a heap of give. There's not going to be much holding it back at all. And it probably actually might not be as painful because there's not much holding it back at that point. So there's a few little intricacies. It's obviously a lot more complex than that. We do a lot of study to try and figure out how we do these things. But yeah, I think Matt Burton, I'm an owner of him. You're an owner of him. He's just a sell, right? Like you have to get rid of him. And move on, because it's going to be probably I think 3 to 5 weeks is usually for 4 to 6 weeks for grade 2 MCL. So you can't hold on to Burton for that long.
No, I agree with that. I'm in a bit of a predicament where I've got Burton and K a week, so I kind of wanted to move K a weeks this week, but I'm going to have to probably move Matt Burton instead. And at 6, there's not a lot of great appealing options at that position either for Supercoach purposes. So it does create a few conundrums for the enthusiasts there. Who were you thinking of initially? Probably Cam Munster's the obvious one, isn't he? Because he's 50 grand cheaper, and the Storm are flying after one game where they looked really sharp. And, I don't think there's anyone that... I think they're pretty matchup proof, the Storm, aren't they, when you look at who they come up against? Even though they got Penrith this week, I think you'd still be confident that the Storm can put a few tries on just with how well they looked last game against Para, albeit.
Yeah, I think Munster's the option, mate, unless you really want to be sicko and get on Adam Dewey with me before he averages 70 for the rest of the year. I think Munster's the call. The only thing I'd mention here, and this is for drafters, like Burton's their goal kicker. So there might be like a Toby Sexton or even a Stephen Crichton.
Kicked today,
yeah. So like those kind of guys. So, I mean, Stephen Crichton is very irrelevant in all fantasy at the moment, Supercoach at the moment, but maybe this gives him a little bit more relevance. The Dogs look pretty good today. They scored well. So yeah, maybe Stephen Crichton averages 40 as opposed to 25. just worth mentioning. But yeah, let's move on to questions, mate.
Sounds good. Questions this week, Brian. So thanks for everyone getting those through to Brian, mainly through the Instagram handles today and Instagram channel. So thank you for everyone submitting. First question is about Ryan Paps. So Paps mentioned the irritation around his knee was a result of stitches calcifying. Does this get better on its own, or does he need to have surgery to remedy this situation?
Yeah, so it can get bad enough where you need surgery. Very rare. It's just something usually you have to manage. Manage. You can get some, soft tissue release and different things around the area to try and loosen up. Break down different things. But it's usually something you just manage with, good rehab exercises, keeping the tissue nice and strong and loose and those kind of things. And then if it gets bad enough, he might need a minor surgical procedure to kind of, remove it. But I wouldn't be I hearing that, I think the main question people are going to ask is, is it something where you'd shy away from Paps because he's got that? But no, that's just a minor thing that he's just going to have to manage. I'm way more, the things you have to worry about with Paps are like his ankle and his knee in terms of the actual structural integrity of it, not a little calcified stitch. That's just an annoyance.
Yeah, for sure. Question number 2, Brian. The question sort of entails here that they remembered Ewan Aiken getting an epidural injection to help his back and hamstring issues. Should this be something that someone like Tommy Turbo looks into potentially?
Yeah, well, I mean, we spoke about Turbo potentially. This latest hamstring issue it could be a SIDEC referral. So, it could be something he explores down the track if they think that the back is contributing. Someone like Sean Johnson, he had similar. So he had calf and hamstring issues. They linked to his back. So he had some had an epidural injection in his back to help with that. And he actually said it worked really well. I think Ewan Aiken still had ongoing problems, but Turbo said that, SJ said it worked really well for him. So look, this is the first mention of any kind of back involvement for Turbo with these kind of things. So I don't think it's something you jump to at the moment, but if it turns out that it's an ongoing problem, it's definitely something he could try for sure.
Yeah, and we see it a lot in the clinic where I work for people that have even fairly chronic back into, bilateral sciatica, so like bilateral leg pains or just radiculopathies that just aren't really settling down. So they do get used in that format as well. The third question here, Brian, is how have they not fixed the problem causes hamstring issues, and then why are some people more susceptible to hamstring issues? What's the go? Why can't we figure out hammies? Why don't we get Bill Knowles over to Australia to fix everyone? What are we doing? That's what we need to do. That's the answer. I'll answer that one for you.
Mate.
Get Bill Knowles over here.
Yeah, look, I
Get
think
him out.
the answer is if we knew how to bulletproof hamstrings, we'd have done it, right? There'd be someone out there earning $20,000 a week for people to train with them. But yeah, then still injure their hamstrings anyway. But look, I think the answer to this is, the best way I put it to my patients is there's a reason that there's an injury in your elbow called tennis elbow, right? It's not because you suffer that injury playing tennis. It's because we see it in a lot of tennis players because it's an area in the elbow that is highly stressed during tennis, right? Like hamstring issues aren't super common in tennis players, for example, because it's not a muscle that is loaded up as much as, say, the forearm or the shoulder or the back or something like that. Hamstrings, like you could call a hamstring strain in the essence of those elbow injuries being called tennis elbow. You could call it like field sport hamstring, like it's just for field sport. It seemed a lot smoother in my head when it was coming out. That was very, very clunky. But yeah, if you get my drift, it's like field sports, any field sport athletes, whether it be NFL, soccer, rugby league, AFL, like all of these sports have high hamstring incidence rates because the hamstring is a muscle that is used so heavily in these field sports. So it's hard to keep up with the amount of load that these guys are putting through their hamstrings because they just keep getting bigger, faster, stronger. It's always going to be the number one injured because it's just the muscle that is used the most for these for these sprinting field sports. So that's the answer to why it's so common, why are some players more susceptible. There's plenty of things. There's long and once again, we could do a whole podcast on this, but long and strong seems to be something where if you have a lengthy muscle fascicle hamstring and it's really, really strong in an eccentric manner, which is when it stays strong as it lengthens, then you seem to be less likely to have hamstring injuries. So on the converse side to that, if you have shorter fascicle length and you're not as strong in those areas, makes you more susceptible. If you have an imbalance between your quads and your hamstrings, you have some hereditary issues. But the big one is once you suffer one, it just shoots your risk of suffering another one up. And I think that's the biggest thing is once one happens, 2, 3, 4, 5, it's just that cascading effect. Mate, from your perspective, have I missed any components there?
ACL. So people have ACL hamstring grafts. That puts them at higher risk inevitably, but that's a pretty straightforward one. Like if you have a hamstring graft of muscles, that they're gonna be more vulnerable to re-injury later. And I think to your point, yeah, just the complex nature of the sports, especially the footy codes, because there's a high aerobic element and then there's multiple high intensity sprint efforts, many, 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 many throughout the game, acceleration, deceleration. So Hemi's under load for that. And you look at elite sprinters, track and field stuff, hamstring and quad injuries are the most common injuries they sustain by quite a lot. They're not getting pec injuries, for example, because they're sprinters. But they are at high risk of those injuries as well. Then they're elite, track athletes as well. So even they haven't fully bulletproof things from that point of view either. So it is worth reiterating. It is hard to rehab these guys from a footy point of view. Next one, Brian, is about neck strengthening. Does that help decrease concussion risk, to your knowledge?
Yeah, there is some evidence that it can help. I wouldn't say, you can have the strongest neck in the world, and if you get hit wrong, you're going to suffer a concussion. But there definitely is evidence, unlike things like headgear and those kind of things, neck strengthening can help decrease concussion risk to a degree. It's not, as I said, it doesn't bulletproof you, but it does help. So you see a guy like, I think Ryan Pappenhausen's done it in the past with his concussion concerns. You see him doing some neck and head strengthening stuff. So there is some evidence that it can help. So you're not wasting your time doing it if you have some concussion issues in your past.
Yeah, get it in your gym regime as you always would. Next question is about Nathan Brown. Brian, what's the update there for Nathan Brown? I'm not too sure what the question's relating to be honest.
Yeah, mate, I think guys like him, and I think I've had a lot of questions about him and Luca Moretti in my DMs, which is another guy from the Eels, Nathan Brown from Manly, obviously. The thing I'll say about both of these guys is they both are injured. The clubs have just released zero information on those injuries, which is really weird because both clubs have put out injury reports with details on other injured players, but these two, Nathan Brown, Luca Moretti, just minimal info. So that's all. I just put it in there mainly to answer the question for all those people in my DMs. I didn't realize that both Nathan Brown and Luca Moretti were such popular players, but turns out they are. So yeah, they're injured. We just don't know what, and we don't know when they're going to return. So just to answer all those DMs.
Another player who's a mystery, Brian, is Jackson Hastings. He hasn't been named in New South Wales Cup. No one really knows why. What's going on there with Jackson Hastings? Friends of the show, obviously.
Yeah, so he had a leg infection that he needed surgery on during the week. I sent him a message and he said he was hoping that they were going to film the surgery so he could send it on to me. So I'll actually send him a message to see, us sickos interested in that kind of stuff. But yeah, he doesn't know why. I said, did you get a cut or what happened? He said he wasn't sure. He just got this abscess kind of skin infection thing that needed surgery, obviously, to kind of lance it and clean it out and those kind of things. So I haven't hit him up to see how long he'll be out for. It obviously depends on how severe the surgery was. Did they need to cut into muscle, those kind of things? But yeah, he probably will need at least a couple of weeks on the sideline, and hopefully we can get that video.
Yeah, hopefully, mate. I guess the only complicating factor might be, depending on what infection shows there, he might have to get a certain regime of antibiotics, which might preclude him from footy for a period of time. So it might be a bit of watch and wait. Was it around the hardware in his ankle as well, or is that?
I think he said the thigh.
Right, okay. So yeah, so not there, because that's the last thing you want is to get a bug that they do tend to lodge themselves in and around orthopedic hardware for some reason for those playing at home. Like I guess people with, knee hip replacements or any orthopedic sort of hardware in place, if you get infection in and around there, it's an absolute nightmare to try and, clean up. And, surgical washouts sometimes not the answer. Sometimes they have multi-resistant bugs. It can be an absolute disaster trying to get those sort of things cleared up. I can think of heaps of people on orthopedic water that I've seen and I'm like, holy hell, this is complicated stuff and it's bad news for the person. When Katoni Staggs comes back, Brian, who do you think drops out? Shibasaki or Dean Mariner? Who are you thinking?
Mate, I'm throwing straight back to you as the Broncos fan. Come on, give us your rant. Tell us why Shibasaki should keep the job for the entire year.
I cannot understand how Dean Mariner doesn't have the inside running here. I don't understand it.
Mate,
Like
he
from the
looked
2 games I've
so
seen,
good the other
he's
night.
electric.
Oh.
He's electric. And he was our leading try scorer last year. He's the absolute business. I know Shibasaki did something in the preseason there, and Madge was backing him. I don't really understand it myself, but mate, Dean Mariner had some good touches the other night. He's an elite player. I think it should be him. Probably nothing else to say apart from that, mate. I think that would make
totally agree with
the
you, mate.
Broncos a more scary prospect if you could put, Mariner, Arthurs, Staggs, Cobbo, Reece Walsh. It's pretty handy. It's pretty handy outside back sort of quadrant or five team there. So that'd be my advice. Last one here's a physio one, Brian. This is an interesting one. So any advice for a physio student? Maybe something that you wish you knew before starting or embarking on a physio undergrad or postgrad degree there. We could probably talk about this for a while. I might watch my P's and Q's here for a certain few things, but what would be your advice for a physio student? That's pretty broad, so you can take it whichever way you want.
Yeah, if you're a physio student and you really want to know our thoughts on this, catch us at Magic Round after a few sherbets, and then we'll really talk your ear off. Yeah, like I think the biggest thing, and like this might be a bit controversial, but just bear with me, and it's something that you and I say a lot, and I think it's not just physio. I'm sure like plenty of medical professionals, I'm sure other professions out there. But like one of our favorite sayings is, geez, don't physios suck? Like there's a big cohort of physios who are just so intense at being the smartest person in the room and making sure that everybody knows about it. And that includes like new grad physios, for example. I know some of the feedback that I've received from many physios who've gone into, say, private practice at places is that they just get treated like they are like bottom of the food chain. And I personally really pride at our practice on making sure that everybody, is on a level playing field. Like, I know the jokes are there that, that's because I have the intelligence of a new grad, but whatever, man. Like I'm fine with that. I just think what I would say to a new grad physio or somebody who's just starting out is just take what you see from physios, particularly on social media too, with a massive grain of salt. That's not what physio is about. It's not about tearing others down. There's a big part of physio where everyone's just attacking everyone else, going, well, I'm smarter than you, and here's all the studies that say I'm smarter than you, and someone else will come in and be like, no, well, here's all my studies and I'm smarter than you. And it just becomes absolutely exhausting. And especially as a new grad starting out, you can be so confused about like, what am I doing here? So I think the big thing I would say is just the best thing about physio is you get to help people. Like that is my advice, is focus on helping people. That is by far, focus on the person in front of you, the patient sitting in front of you. Don't tend to get too tied up in all the politics that happens amongst health professionals and particularly other physios, because it can just get really exhausting. All of that stuff, all the what is good, what does the research say, that should absolutely inform the way that you treat that patient in front of you. But I think the proverbial pissing contest that comes out from physios, it gets so lame after a while, James. And I know you think exactly the same. A lot of our mates who've moved on from physio to become doctors, whatever they may be, have commented the same about physio. I think we're all relatively on the same page. But yeah, mate, I mean, what advice would you give to a physio student? I don't want it to sound like physio is awesome. And if you find a good place to work, and I like to think that the place I work is a good place to work because we have physios who have stayed on for years and years and years. Our main problem is finding physios for an ever-growing clinic. We just need more and more physios. We're not losing physios, we're growing. So my thing would be look for a really good mentor, someone who's not going to treat you like bottom of the barrel. You are somebody you can go to them, talk to them, and be on the same page. It's not like some superiority complex. You shouldn't still feel like you're at uni when you come out and you're a physio, I think is probably the biggest thing. James, sorry, I ranted. I'll try not to rant too much more. What do you got for me? I'm sure you've got a few pearls.
No, you hit all the big ones, I think, Brian. I would definitely agree with you. As a huge generalization, we do suck. There's no doubt about that. And I can put ourselves in there as well. I'm sure there's lots of people think we suck. But as a general rule, there's a lot of people out there that have got a bit of how you're going about them in the physio department, that's for sure. So that's hard. I think as a student, the undergrad stuff is pretty brutal. It's pretty tedious. It's pretty black and white. I think we have a really embedded, we need to fix people ingrained in our study as well. So I think that's a big shortcoming, because I think what we see commonly is like we tell people how to move, we tell them how to behave, we tell them that what we are doing is the best, when oftentimes I think we sell a lot of people short that they can really drive their own recovery, and we can be alongside them as well as part of that. But we sell people short a lot, or we sort of talk down to them a little bit. I don't know. There's a sort of a sentiment out there that I don't really like about the profession. But to your point, there's heaps of good stuff about it. There's the variety of things that you see. I think the outcomes that you can see that are meaningful and make a difference, and that sort of applies for so many different things and so many different cohorts. I'm in a sort of multi-disc clinic, so I work with like pain specialists, psychiatrists, rehab specialists, addiction specialists, and there's also OT, psychology, and also so like nursing is part of that as well. So I get like a really broad experience across a lot of disciplines, and I honestly learn more from them than I do from my own. And that's been really, really nice to be a part of as well. And that's the good thing about health. You're part of a team. Oftentimes you've got a lot of different people from a lot of different backgrounds, and it makes life really, really interesting. The one thing that's really hard as a student, just to finally wrap that up, is the prac year can really make or break you. And depending on who you get matched up to, which is way out of your control, that can destroy you. And you can walk away from that going, I don't think this is for me. I don't think I'm any good. And that can really suck, because some people just get absolutely shafted there. Like I know that I've done, clinical education sort of like head roles across like certain parts of the hospital and health service, and heaps of people that do clinical education don't want to do it. And that sucks as a student, because you're with someone that's sort of like, I don't really want to do this, I don't really rate this, and you're just trying to do your best and get in, get out, and learn what you need to learn, and sometimes in an area that you may not be that interested in. So the prac year does suck bad, but you do have to just try to, lace your boots up, chomp down on the mouth guard, and just work your way through it and just put in your best effort. But that can be really brutal, and that's way to your control. And I think that's a big shortcoming of physio as well, to be honest.
Yeah, mate. I think I definitely want to say that there is not a day that I wake up and I think about work as like I don't want to go to work, and in terms of going and helping patients. Like it is one of the most rewarding jobs ever to be able to be there with someone from their lowest point in terms of pain, like, not walking at all. And I'm not performing miracles. I'm not fixing people, but I'm assisting them on their journey, and I'm there with them from the start to the finish where they're pain-free and they're back doing what they love. And being able to do that in your job is so cool. And I've been doing it for 15 years now, and I still never get tired of that. Like that is really awesome. So I know I've said all that stuff. I more say physio suck and all that kind of thing, because it seems like a lot of the big personalities in physio, particularly across social media, are those guys who are really polarizing and talk down to a lot of the profession. And I just think from either end of the spectrum, I just don't like people trying to one up each other. Like I'm not saying it should be all roses and butterflies. I get that, but I just feel like it leaves a lot of people disenfranchised with what is right and what is wrong as a physio. And I think at the end of the day, what is right is just helping the patient in front of you. And if you're able to do that in a great workplace, it's the best job. Like, I still love it. I'm never going to stop doing it if I can keep doing what I'm doing, because I really, really love it. All right, let's go to SuperCoach Corner, mate. You have a lot to talk about. I have a lot to talk about. Let's get straight into it. What was your score and how are you going to put out all these fires?
So you got me in the good bloke stakes this week, Brian. 11.20 for me, so pretty unders. I only made one trade last week. I went safe after Jack Goz, so I've got 212 and 3 trades this week to make. So I've got huge big fires to put out. Like I said before, I've pretty much got like the World Trade Center on fire in my SuperCoach team at the moment. It's pretty grim. So I've got a Dave Fifita issue. Obviously saw that today, played 30 minutes off the bench. I healed in through week 1 and saw that and nearly just had an aneurysm. I was just like so upset with it. And then seeing today didn't help. Obviously, Matt Burton, the injury there is going to be lengthy. Kale Weeks has really underperformed. Then I've got Liam Martin and Tom Duffy as well as issues. I think Turbo's a massively volatile captaincy play now. So I think even that's a pretty unreliable one. I suppose this week you probably got to get one of Jesse Arthur's or Tamale. I think you've mentioned their break evens there below, Brian. Like Arthur's is neg 86 and Tamale's neg 69, something like that. They're kind of no brainers. I think I've got to get Munster at 6 because I've got no Matt Burton, and KO Weeks might just get a reprieve this week because he might be my sub in for Tom Trbojevic later in the week, so he might get one more week. And the Raiders are a hard one, mate. Like I've paid $5.30 for KO Weeks, thought he's going to be a lot better. They don't buy till round 15, so I could just play the long game there with him. It feels yuck though. It just doesn't feel like something that I want to do because if he doesn't start scoring points, he's just going to hemorrhage cash. So that's going to be really, really, really tricky. The last one, I guess, if I do Arthur's or Tamale, I do someone up to Munster, then I've got one left over, which probably looks like Liam Martin to Tino. I think Haas might be a little bit out of reach in terms of money. I think I just have to start Dave Fifita for one more week. It stings massively, but he doesn't drop cash this week. I can probably just put him in my 17 and hope that he gets some attacking stuff and gets to 50 or 60 or something like that. Or he just gets named in starters and maybe he gets a score. I don't know. That a week's a long time in footy, but it feels crap either way. Other options, I suppose, is, a Duffy to Hooker situation via Sandon Smith. Might go to Humphreys. You might go to Mamazelas. Even Tom Starling were pretty handy. The other one, C.L. Wong, played 80 minutes on an edge, scored 70 without too much attacking stats there. So he might be in play for 318K. You're doing the Trent Robbo thing, which, again, doesn't feel good. That's always a bit of a dicey one, but with the way that the Roosters are set up and given that they got the win against the Panthers, maybe CY Wong locks that down for a little bit longer. Maybe he realises the potential there. Not really too sure. I guess moving forward to week 4, I was just making those trades with week 4 in mind. So week 4 probably looks like, I think, Jack Howarth, Christian Tuipulotu from the Dragons, and then move Dave Fifita on to someone at second row. That'll be the option. Second row or front row, I guess I could move Horsburgh down. So he's not going to lose money this week, so I might have to look at doing 3 trades this week, 3 trades next week, and maybe even 3 trades in round 5 as well. So it's going to be a bit of a dicey one. The Turbo thing could throw that into massive disarray. If he's going to be missing a week or multiple weeks, that could be really, really disastrous. But yeah, there seems like a lot of good trade-in options this week, Brian, and not enough trades to do so. So there's going to be a lot of tricky things for people to weigh up. I think the Jesse Arthurs thing, that would mean that I guess myself and yourself would have Selwyn Cobbo, Jesse Arthurs, and maybe Shibasaki. I mean, as a Broncos fan, I kind of love it. But for you, you're probably like, well, I might be a bit overexposed here to Broncos. Hey, but what are you thinking in terms of your trade plans, Brian? You went well this week. Actually, you scored real well.
Yeah, mate, 12.92. Pretty happy with that. I did go Geimer to Gachevsky, which was a bit of a vomit, but, Geimer wasn't playing, so... And I thought if Madge just keeps sticking to his Gachevsky, Shibasaki guns, then I'll get on that. So wasted trade, 1 trade already wasted. But anyway, so Burton's definitely going. I have the flexibility that I can go my 70 averaging Adam Dewey up to 5'8" and get any CTW. So I could go straight to Munster, but I'm just happy to wait a week on Munster with all the negative break evens that are out there. I think someone like yourself, you have to, because you've got like the Burton what's the Raiders guy?
Okay, a week's
yeah,
combo,
KO week. So you don't have that flexibility. Whereas for me, because I've got that flexibility, I'm happy to leave Munster till the following week. So Burton to either Arthurs or Tamale, 86 and -69, break even. So one of those two, and then Hopgood to Haas is locked in, like 7 offloads, mate. He put out 100 in pretty much base stats. I'm very glad I didn't go to Carrigan last week. Had a bit of ACL return love in my eyes, but that has been wiped away because Haas just has to come in this week. I'm really split on the third trade. I don't know whether to get the other CTW, so Arthurs or Tamale, or go like up to a Mamazelos because he's -39 break even as well. So I'm pretty boring this week. I just realized Tui Piloto has the bye this week, which could not come at a better time because it leaves it that I can potentially boost next week and bring him in as well, along with Munster and somebody else. So like I think my main toss up is who to go out of Arthurs and Tamale and Mamazelos. I have to get 2 in out of those 3 because I'm set on Haas. I need to bring him in, but I can only get 2 out of those 3. I think if I go anything, I'll probably get the 2 CTWs and wait a week on Mamazelos. Because the other guys I want to get, then I might want Matty Nicholson next week potentially too. So yeah, we all knew this would happen. We'd get to this point and we need like 6 trades a week. Like if only you could look into your crystal ball and do some trades last week to kind of get yourself sorted. But yeah, next week I'm looking at Munster, Matty Nicholson, and then Dylan Lucas in round 5 because he'll obviously play this week and he's a great trade in this week, but he's just got the buy in round 4. So I'm pretty happy to wait till round 5 for him. But yeah, they're the ones I'm eyeing off. Gun to your head, mate. Let's say I bring in Arthurs. Who would you pick? Well, who would you leave out of Arthurs, Tamale, and Mamazelos? Who do you reckon's the least?
Be Mamazelos, I reckon, because Tamale's just been so impressive. Like, he should be in your 17, I reckon. Like, I don't think you could even leave him on the bench, to be honest. Arthurs, I don't know if he's a 17 start, but he's just going to make so much money. I think you just got to have him in your team because he's just going to turn over the cash. Broncos are scoring a lot of points, so I don't think Arthurs is a bad one. He might be one of the final selections in your 17 if you've got a lot of pretty solid players and he's a high upside kind of guy. But I agree with you on Haas. I think Haas is just a must-have at that position, and I think Arthurs and Tamale are the one. Mamazelos, is he going to separate from the other hookers? Maybe, maybe not. He did get 80 minutes just gone, but, I think there's a lot of other options at hooker where you may not necessarily miss out too much there.
Yeah, no, that is definitely the way I'm leaning at this point in time. Broncos have got the next 3 games. I mean, they looked pretty average on the weekend, but Arthurs and Selwyn and those kind of guys still scored well. So next 3 games at Suncorp, I think round 4 is against my Finns, and the Finns have not looked very good at all. So yeah, I'm happy. Well, I'm not happy because it's 3 CTWs from Broncos in my CTW, but anyway.
Yeah, they've got the next 4 at Suncorp, actually, Brian.
Oh, jeez. Yeah, okay.
Yeah, so they've got Cows, Finns, Tigers, Roosters, and then the Warriors over there in round 7. So, yeah, it's not too bad a run they've got upcoming, actually. I think even if you load it up on Broncos, it's probably not the dumbest thing, even though I'm a massive homer.
Cows,
I'm not going to talk it down.
Cows, Finns the next 2 weeks, you just take that to the bank. So, I mean, there's already been some weird results, like, where, so maybe Todd Payton puts a rocket up them and they come out and do really well next week. But I'm going to bet on the Bronx absolutely lighten it up. So I think I might start at least 2 of the 3 Bronx in the CTW for next week is the way that I am leaning. All right, guys, that is a wrap for this week. Always, if you like the pod, give us a review, recommend to a friend. James, have a good week, mate. Hopefully the Finns can have a win next week along with the Bronx, and then we will both have something fun to talk about because we completely avoided talking about our teams mostly this week because dual losses is never fun for the pod.
No, it's always a bit of a downer for the Sponge, but hopefully looking up on SuperCoach because my week was not a good one this week. It's gonna be tough sledding for yours truly moving forward.
Was round 2 is round 2 your bad round? Is that the round that you broke your side up to get Payne Haas last year? Yeah,
that's why I'm terrified about how bad it's going to go because I'm like Mate, I've already gone bad this week. Yeah, so last year was round 2. Blew it up for Payne Haas, and he got injured for 6 weeks. And then had to boost again. So yeah, I was way behind it there. I was sort of lucky that, I did score poorly, but I've got Katoa to come back in. So at least second row is like a little bit shored up, but Jesus Christ, the Fafita thing, I don't know what's going on with him getting selected in teams in the last 12, 18 months, Brian. It's the most bizarre situation ever. Don't get it.
Yeah, like potentially it's the coming off the ankle thing over the off season, but I mean, didn't he start in the trials?
I had the trials.
Yeah, I'm pretty sure he started too. Like,
Yeah.
just I don't know. Yeah. Anyway, we'll be confused about Dave Fafita's selections, I think, for the rest of our days. But anyway, guys, yeah, you know why you're here. Up the mighty Redcliffe Dolphins.
Suspected broken leg.